Hey everyone, we are talking about immunizations today. So, immunization or vaccines, you can use those words interchangeably. Vaccines prevent dangerous and potentially deadly diseases. We have eradicated many diseases due to the use of immunizations. So, vaccines stimulate our immune system to produce antibodies which protect us against the pathogens. Vaccines help develop immunity by imitating the infection. So this imitation does not cause illness, but it can cause minor symptoms. So you may hear, oh, the flu shot gave me the flu. No, that is incorrect. You may have some minor symptoms, such as a low-grade fever, but if you actually get the flu after having a flu shot, it either means that the flu vaccine was not effective and you had a different strain of the flu, because that can happen, or you were exposed to the flu prior to that flu shot actually developing immunity and producing those antibodies within your body. So no, an immunization or vaccine cannot cause the disease in your body, but there are other things that can happen. So I just want to clarify that, because that is a big misconception in the world. So immunizations can be given by mouth. Many of you might not have known that, but there are some immunizations given by mouth, especially to our itty bitties. Injections is what we usually think of, and then there are also intranasal sprays. Now, the intranasal sprays are usually live viruses or vaccines, meaning that if you're like pregnant, you can't have the intranasal sprays. They do make those for the flu, and they're not recommended for certain individuals. But just know that there are different types, so they can be given orally, through injections, and through your nasal passages. Typically, immunizations are given during routine scheduled appointments. So during your routine visit for your kiddo, they will get their immunizations. So there is a schedule that physicians follow to keep patients on track with receiving their immunizations. Now, if someone does not follow the schedule, there is a catch back up schedule. There are some parents that choose not to immunize based on the schedule, and they kind of have an altered schedule, and so you'll actually work with the doctor or the physician to catch them back up. They often want them caught back up by school age so they can enter public schools. But the goal of the immunization schedule is to protect children early in life, when they're the most vulnerable, right? Their immune systems haven't had time to build up, and before they have time to be exposed to these potentially life-threatening diseases. All right, let's talk about preparing for vaccination administration. So you may not know this, but medical assistants are allowed to give vaccines. They are allowed to administer immunizations. So it's important to know about your immunizations and know how to store them properly. You'll want to follow the manufacturer's guidelines on if they need to be refrigerated or stored at room temperature. So you're going to follow those guidelines set forth by the manufacturer. You're also going to check patient allergies. The allergies are very important for any type of medication administration, and particularly vaccine administration as well. The allergies to eggs, gelatin, any type of antibiotic, yeast, or latex products can cause adverse reactions in many different vaccines. So for instance, if you're allergic to eggs, you may not be able to receive the flu shot. So there are different things that you need to check and make sure that there won't be any type of reaction due to these allergies. And then you want to assess the patient. You want to make sure that the patient is healthy prior to receiving their vaccinations. This is also why they're given during those regularly scheduled visits, because we want their immune system to be at their highest when they get these vaccines. If they're suffering from a cold or they already have a fever or other illness going on, you would not administer the vaccine at that visit. So let's talk about giving vaccines to pediatric patients. It's already difficult enough to give vaccines and shots to adults, so it's even a little bit more difficult when we have those children we're working with. These infants and toddlers that we give immunizations to, they must be held in a way that they cannot move, right? You're going to be working with a very sharp needle, and you want to make sure that it only goes where it's supposed to go, right? It's not going to be hitting you or mom or dad. We need to make sure that this patient is controlled so that the injection goes in the right place. You may need help from other staff members, from parents, to hold the child securely. And it's important to remember when you're having to hold down a patient that this is for their own good. You are not trying to hurt them in any way, that you are trying to help them, right? Because it'll hurt your heart when they're screaming at you and crying and kicking and yelling. And so just realize that this is for their own good, and it has to be done. So try and work as efficiently and quickly as possible, but also keep the safety of yourself, others, and your patient in mind. So a lot of times it's that anticipation of the injection that causes high anxiety, especially those that kind of understand what's going on. So babies, they're not going to know it's coming, but those toddlers, those preschool kids, even those school-age kids that have a lot of anxiety, they're going to start demonstrating that as soon as they walk through the door, right? They're going to know that shot is coming for them. So it's important for the MA to maintain a calm demeanor and be very deliberate, right? Like we're coming in here to do this. There's no ifs, ands, or buts. We're not going to talk our way out of it, right? This has to be done, but we're going to be calm and compassionate through it. Okay, adverse reactions and patient education. So adverse reactions are defined as any undesirable after effect once a vaccine is given. So there can be localized reactions. This could include a little bit of redness, a little bit of irritation, or maybe even a little bit of itching just at the site. So it's very localized to where the site is. And these are the most common type of reactions. A systemic reaction may include like a low-grade fever. And then an allergic reaction can be severe and life-threatening. It might include hives, a rash all over the body, closing up of the airway, swelling of the lips, mouth, throat. All of that is life-threatening and needs to be addressed immediately. Syncope can occur and be an adverse reaction following a vaccination. So syncope is also known as fainting or passing out, and it can occur after a vaccination, and it's the most common in adolescents and young adults. And I like to tell this story, although it's embarrassing, about myself. When I was an adolescent, I forget how old I was, but for whatever reason, we were moving internationally, and I had to get like 3 or 4 immunizations, and so they were going to do 2 in one arm and 2 in the other, or something like that, 1 in one arm and 2 in the other, and I had built up so much anxiety for this occurring. Even though I was older and I was calm about it, I still was so anxious, and as soon as I was stuck, I went back. Luckily, I was on one of the physician tables, and so they assisted me down onto the table, and I came to rather quickly. But syncope can occur, so it's important to know that can happen, and to stay calm and assist the patient through that. Don't run out of the room screaming or anything like that. So it's your role as the MA to include patient education after the immunizations or even before. I think it's important to do it before and after. After, you're probably going to be dealing with a parent and a screaming kid. So talk about the information before if you have time, and educate the parent about what the vaccination is, why it's important for their child to have this vaccination, what are some of the adverse reactions that can occur, and what to look out for. You can also inform the parent that they can give their child Tylenol or ibuprofen to help with some of those symptoms, that uncomfortable pain after an immunization. And so those are some of the things that you can educate the parent on, which are important, because a lot of first-time parents won't know what to do with their kiddo after getting these immunizations, or what to look out for, or what's normal and what's abnormal.